السلام عليكم. محاضرتنا اليوم هي الميدياستاينم. The mediastinum is a space in the thorax that contain a group of organ, vessels, nerves, lymphatic, and their surrounding connective tissue. It lies in the midline of the chest, between the pleura of each lung, and extends from anterior to posterior from the sternum to the vertebral column, and superior to inferior from the thoracic inlet to the diaphragm. Anatomical division of the mediastinum. Mediastinum can be divided into parts based on their relationship to the fibrous pericardium. We divide the mediastinum to superior mediastinum and inferior mediastinum according to imaginary line extended from the sternal angle to the T4 intervertebral disc space. We call the transthoracic plan, our plan of Ludwig. Above this plan is the superior mediastinum. Below this plan is the inferior mediastinum, which is divided into three parts. Superior mediastinum is a space bounded anteriorly by manipurium of the sternum and posteriorly by the body of vertebral body from T1 to T4 vertebrae. The inferior border is the transverse plan extending from the sternal angle to the T4 intervertebral disc. The contents of the superior mediastinum from after the manipurium of the sternum, it is the part of the thymus gland, then the brachiocephalic vein and superior vena cava, after that the aortic arch and its branches, then posterior to the trachea, esophagus, and thoracic duct, some lymph nodes. Inferior mediastinum extend from the inferior border of superior mediastinum to the diaphragm. It is divided into three spaces by fibrous pericardium وراح نقسمها إلى anterior, middle, posterior. Anterior mediastinum is the portion of mediastinum anterior to the pericardium below the thoracic plan that contains mainly mediastinal fats, where remnants of the thymus gland, lymph nodes, and mammary vessels. Middle mediastinum is the largest subdivision of the inferior mediastinum that contain the important organs, the heart and pericardium, and the vessels, اللي هي ascending aorta, pulmonary trunk, superior and inferior vena cava, right and left phrenic nerve, tracheobronchial lymph nodes. Posterior mediastinum is between the posterior part of the heart and the thoracic spine, extend behind the posterior part of the diaphragm as it slope inferiorly. Contents of posterior mediastinum اللي هي esophagus and the arteries وال descending aorta and its branches, الفين اللي هي azygous vein, hemiazygous and accessory hemiazygous vein, vagus nerves, neck nerves, and thoracic duct, some lymph nodes اللي هي posterior mediastinal lymph nodes. Radiological feature, frontal chest X-ray. The heart and the great vessels forming the characteristic contour on the frontal chest radiograph. The right side of the heart border formed mainly by the right atrium. Above it is the superior vena cava. And the terminal part of the IVC may be seen just medial to the cardiophrenic angle, which is usually sharp. Left side of the mediastinal contour is formed by the shadow of the subclavian vessel superiorly. Below it, the aortic prominence, which is called the aortic knuckle or knob, formed by the posterior part of the aortic arch. It may be indistinct in young people and very prominent in older people, especially if there is aortic unfolding. Sometimes we see a small nipple-like may be seen projecting from aortic knuckle. This is caused by the left superior intercostal vein as it traversing the aorta to drain into left brachiocephalic vein. Below the aortic knuckle is a space called aortopulmonary window. Failure to identify this clear space indicate pathology. The pulmonary arteries and veins form densities of hyaline on the frontal chest radiograph. Lateral chest radiograph, the heart shadow lie behind the lower third of the sternum, anterior border mainly formed by the right ventricle and outflow tract, and posterior contour mainly formed by the left atrium above and left ventricle below. IVC may be identified as a triangular structure crossing the diaphragm to enter the right atrium. Lymphatic system. Lymphatic system consists of multiple lymphoid organs containing the cells of immune system and the lymphatic vessel, which transport interstitial fluid as lymph back to the venous circulation. The lymph is collected by major lymphatic ducts اللي هي right lymphatic duct والthoracic duct. Thoracic duct arise from saccular lymphatic reservoir in the posterior abdominal wall, which is called the cisterna chyli, which lies behind the right crus of diaphragm, anterior to vertebral body of L1 and L2 vertebrae, then passing through aortic opening of the diaphragm at the level of T12 vertebrae. Then ascend into the posterior mediastinum along the right side of the or anterior to the vertebrae. At the level of the T5 vertebrae will transverse from right to left side and ascend to the neck, traversing or arching over the left lung to drain into the brachiocephalic vein at the junction of the left subclavian and left internal jugular vein. It receives lymph drainage from the left side or left thorax as well as left side of the head and neck and left subclavian trunk اللي هو من left arm. Also drain lymph from the abdomen and legs that drain through cisterna chyli. هذه هي بالصورة. Another one here, right lymphatic duct, which is formed by mainly right jugular trunk, or right subclavian trunk, and right bronchomediastinal trunk. It's a short course, has a short course ranging from 1 cm to 2 centimeter, usually ranging to systemic venous system at the junction of the right internal jugular and right subclavian vein. The right jugular trunk drain the right side of head and neck. Right subclavian drain the right arm and the right half of thorax and abdominal wall. Where right bronchomediastinal trunk drain the hemithorax, including the right heart, right lung, and part of the liver. Mediastinal lymph nodes contain numerous lymph node group which may enlarge in disease state. حسب كتابنا ريان هو قسمها إلى anterior mediastinal nodes اللي تشمل ال internal memory chain that accompany the internal memory vessels، والother group هو ال pre-aortic group اللي هي تصير anterior to the ascending aorta. Middle mediastinum اللي هي ال bronchopulmonary nodes at the hilum of the lung والcarinal nodes below the hilum, tracheobronchial node above the tracheobronchial junction and right and left paratracheal. سأقفت صورة ثانية راح نوضحها. هذه right والleft paratracheal، هذه subcarinal bronchopulmonary nodes. أكو other groups اللي هي الazygous nodes in the right tracheobronchial angle والpretracheal nodes تصير anterior to the trachea يعني تبين بالlateral view المفروض. Aortopulmonary node between the concavity of aortic arch and pulmonary artery. The posterior mediastinal lymph nodes are found along the aorta and esophagus and also anterior to and on the either side of spinal column. We take their name according to location as paraspinal, para-aortic lymph nodes. Normal nodes not appreciated on the plain chest radiograph, but may be seen in the CT scan if measure more than 1 centimeter in diameter. They are likely to be pathological. هنا أكو فد سيستم ثاني مقسمينها الCT scan إلى 14 stations by International Association or Study of Lung Cancer. قسمينها إلى zones. أول zone هي supraclavicular zone، هي station 1 اللي هي تعتبر low cervical أو يسمونها supraclavicular lymph nodes. other zone اللي يسمونها upper zone superior mediastinal nodes اللي راح تقسمها إلى 3 stations اللي هي station 2 اللي هي الupper paratracheal lymph nodes. Station 3 اللي يصير anterior prevascular and retrotracheal nodes. Station 4 اللي هي lower paratracheal nodes. Aortopulmonary zone لنا two station. Station 5 اللي هي sub aortic nodes تصير بالaortopulmonary window. Station 6 اللي هي يصير para aortic على جانبي الأيورتا ascending aorta or chronic nodes يسمونها. Subcarinal zone اللي هي station 7 هي subcarinal lymph node below the carina. Lower zone هي inferior mediastinal nodes station 8 اللي يسمونها para esophageal على جانبي الاسوفاجس below level of carina. Station 9 اللي هي along the pulmonary ligament اللي هي pulmonary ligament nodes. الهايلر and interlobar zone اللي يسمونها pulmonary zone هذه تصير يعني along the bronchus يسمونها هايلر nodes station 10 11 interlobar nodes. Peripheral zone pulmonary nodes station 12 اللي هي lobar nodes 13 هي segmental and subsegmental nodes according to division of the bronchi. خلصنا الميدياستاينم ناخذ الثايمس. Thymus هو lymphoid organ. We found the anterior mediastinum responsible for production and maturation of T cell until puberty. Consists of two lobes, usually left, more larger than the right, occasionally united or may be separated by intermediate lobe. Depending on age and size, the normal gland may extending from lower border of thyroid gland to fourth costal cartilage. It is visible on chest radiograph within 24 hours of birth, gradually involuting after 2 years of age. It is rarely seen on chest radiograph after age of 8 years. Sometimes we see the thymic cell sign. The thymus may protruding to one side from mediastinal contour. The lung distal to this contour normal and do not affect the lung tissue, not deviate the normal structures. On CT scan, the thymus is homogeneous with the density similar to that of the muscle. On MRI, has high signal more than that of the muscle. By ultrasound, it is homogeneous with multiple hyperechoic foci, which is called the starry sky. Also, it is pliable in children, should not compress or displace adjacent structure. The azygos system is a collective term given to H-shaped configuration of azygos, hemiazygos, accessory hemiazygos, and left superior intercostal veins. Azygos vein initially arise at the union of right ascending lumbar vein, right ascending lumbar vein and right subcostal vein at the level of T12. It enters the thorax through the aortic hiatus in the diaphragm and ascend posteriorly along the vertebral bodies, arching over the right main bronchus at the level of T5 to T6 vertebrae and enter the superior vena cava posteriorly at level of T4. Azygos vein receive the lower 8 right-sided posterior intercostal vein, also the right bronchial vein from the right lung. Although there is much variability, the azygos vein receive accessory hemiazygos vein and hemiazygos vein at the level of T8 and T9 respectively. Hemiazygos vein usually arise from left ascending lumbar vein and left subcostal vein and pass through the left cross of diaphragm. It's received range from the 9 to 12 posterior intercostal vein with some esophageal veins. Hemiazygos vein ascend the thorax to the left of the vertebral body and pass behind the esophagus at the level of T9 to join the azygos vein. The accessory vein drain the superior left hemithorax. It arises from 4th to eighth left posterior intercostal veins and lies longitudinal on the left side of vertebral body. It also drains the left bronchial veins and some veins from esophagus. It joins the azygos vein at the level of T8. mediastinal lines and strips. أول مرة راح نعرف شنو الفرق بين mediastinal line strips وانترفيس. نرجع طيب الصورة كاملة. Mediastinal lines are thin, less than 1 millimeter in width, linear opacities that result from contact between two aerated structures outlining thin intervening tissue on both sides, such as anterior and posterior junction lines. Mediastinal strips here band that resulting from air outlining thicker intervening mediastinal structures. Mediastinal strip represented on PHS radiograph, including a right and left paratracheal strip. The interface here or edge are produced by contact between aerated lung and adjacent mediastinal structures. The mediastinal interface, including the right and left paraspinal, azygoesophageal, aortopulmonary strip, and para-aortic line. The anterior ejection line formed by the opposition of two lungs anteriorly. It begins below the clavicle, always end at the right ventricular outflow tract. The posterior junction line, this is formed by opposition of two lungs posteriorly, extend from above the clavicle, vertically downward to arch of aorta. The line represents 4 layers of the pleura between the posterior part of the lung seen from the front. Right paratracheal strip, the lung is contact with the trachea from the level of the clavicle to the azygos vein in the right tracheobronchial angle. As the trachea is airful, the right tracheal wall is seen as a strip. We should not measure more than 3 millimeters. The left tracheal wall is separated from the lung by the aorta and great vessel. Therefore, it is not seen. Left one is formed by interface of the medial pleural surface of the left upper lobe and left lateral border of the trachea, and or fat adjacent with air within each structure forming the outline. It may not visible if the left upper lobe contact the left subclavian artery or left common carotid artery. The pleuroesophageal line formed by the right lung outlining the right wall of the esophagus above the level of azygos vein. If the esophagus is distended with air, pleuroesophageal strip is seen. The thickness of this representing the thickness of esophageal wall with the pleura and should not exceed more than 2 millimeters. Azygoesophageal line, the azygos vein is closely related to right posterolateral aspect of esophagus and posterior mediastinum. The right lung of the two structure forming the azygoesophageal line. هاي الصورة توضح كل اللاينز اللي ذكرناها. الانتيرير والبوستيرير جنكشن لاين. هذا الأصفر باراتراكيال ستريب. هذا البراون هو البلورو اسفاجيال ستريب. هذا الانتيرير جنكشن لاين والبوستيرير سبيرير جنكشن لاين. The paraspinal lines, these are outlined by the lung opposing the vertebral column, the right sharper than the left, as the descending aorta tend to reflect the pleura of the thoracic spine on the left, making the line more indistinct. The distance from the lateral border of the spine to the line may vary with body habits, maybe reaching 1 cm on the left in obese people with paraspinal fat deposit. Widening of the paravertebral soft tissue on the right is always abnormal. Widening of paravertebral soft tissue beyond the transverse process is always abnormal. The aortopulmonary strip, this is a reflected pleura from the aortic arch to pulmonary trunk, المكان a left pulmonary artery. It defines the lateral boundary of the aortopulmonary window. Posterior tracheal strip, this is seen on the lateral view and represent the posterior wall of the trachea outlined on either side by air. It's measured 2 to 3 millimeters. If collapsed esophagus is opposed to posterior trachea, the strip may measure 1 cm If there is air in the esophagus, that's it represent posterior tracheal and anterior esophageal wall. السل CT level هاي axial CT scan at level of T3 اللي هو هذا الليفل يعتبر above the aortic arch. راح نشوف بالميدل mediastinum 3 vessels اللي هي ال branches of aortic arch اللي هو ال left subclavian vein وال left common carotid وال brachiocephalic العفو artery مو vein. هذا ال right brachiocephalic vein، هذا ال left brachiocephalic vein، هذه ال posterior اللي هي التراكية، وبالposterior mediastinum هو الإسوفاجس، وأكيد anteriorly هو mostly fat. الليفل الثاني هو الليفل of T4 اللي يصير at the level of aortic arch. هذا هنا بدأ يتكون aortic arch، هذه التراكية نفسها. At this level the lower part of aortic arch يصير هذا قلنا to the left of the trachea. الارش of azygos vein هو اللي راح يصير بالرايت سايد. وهذا نفس الشيء هنا superior vena cava يتكون من الاتحاد الرايت والليفت brachiocephalic vein. level of T5 هو level of carina، هنا يسمونه level of bifurcation، إنه صار tracheal bifurcation to right and left main bronchus و right pulmonary artery left pulmonary artery. هذا الأيورتيك arch، هذا الأزايغوس vein posteriorly. هنا ال ascending و descending aorta. Level 6, this section passes through the upper part of the heart. Right atrial appendage may be seen overlapping the origin of the aorta. The coronary arteries come off the aorta at this level. level T8 هاي نشوف ال whole chambers of the heart اللي هو ال most anterior one right ventricle posteriorly وال left atrium وال right heart border formed by the right atrium وال left هو by left ventricle. الليفل الأخير هذا ال T10 part of abdominal cavity is also seen as a dome of diaphragm reach the level of approximately T9. Esophagus refers the diaphragm at this level of the spleen والliver راح تبين بهذا السكشن. سلكوز.
شكرا جزيلا حوري عايشة تيدك. اكو احد عنده سؤال قبل ما نروح للكويز؟ ماكو؟ يلا دكتور علي طالب.
نعم دكتور.
يلا الأي
رقم أي الأسندنج أيورتا.
This is the ascending aorta. هذا يا ليفل، تقدر تقول لنا يا ليفل من الليفلز اللي شرحتين؟ تقريبا at the bifurcation.
نعم دكتور.
أي صحيح.
تعرف يا ليفل هذا 4 لو 3؟
This is the level 3 I think.
اي 4 تقريبا. اي علاق
4.
هذا الفور.
اوكي.
وشنو معنى ليفل 4؟ هذا ليفل اوف فورث ثوراسيك
Fourth thoracic vertebra.
اي اللي هو يصير بالبايفركيشن مالت الايورتا. هذا حتى البارحه شرحها دكتور سرمد. اوكي. الاخ جليل بي.
السلام عليكم.
عليكم السلام.
بي superior vena cava.
This is the superior vena cava. طبعا superior vena cava هنا تشوفين بي كونتراست. معناها شنو ها؟
هذا فينس يعني فيس؟
لا يعني هو الايرلي انجكشن مال الكونتراست مو انتو اياه بالارم. اي فاول ما يتلون طبعا السوبيريور فينا كافا، لانه هو يجيب الكونتراست للرايت اتريوم ورايت فنتريكل وبعدين يتوزع. مو صحيح؟
نعم استاذ.
اي بان صباح.
السلام عليكم.
عليكم السلام.
سي هو المين pulmonary trunk.
This is the main pulmonary trunk.
نعم.
مو صحيح؟
ايه.
ومنطي تقريبا الليفت
بدأ بعد
نشوفه.
البرانش، بعد
بالضبط.
البرانش مع الليفت
دينا
تمام.
سعدون دي.
نعم أستاذ. دي is the left main bronchus.
This is صحيح. This is إسراء.
نعم أستاذ. الإي هو
إيه.
left internal thoracic artery.
left internal thoracic vessel نقدر نقول إيه. أوكي. بس مسوية واحد